If you ever dismiss a persistent itch as just getting older, what I'm about to share with you might change how you think about those nagging sensations your body keeps sending you. I'm going to walk you through 5 specific types of itching that could be your body's way of whispering about something much more serious than dry skin or aging. These aren't the kinds of itches that come and go with the weather or disappear when you change your soap. These are the stubborn ones, the ones that keep you awake at night, the ones that don't respond to any cream or lotion you've tried. Now, before we dive in, I want you to know this isn't about creating fear. This is about giving you information that could literally save your life or the life of someone you love. The stories I'm about to share are real, the medical connections are documented, and the patterns I'll describe have been observed by doctors across the country. Most importantly, I want you to remember that knowledge is power, and early detection often starts with paying attention to the small things your body is trying to tell you. Let me start with something that might surprise you. That persistent itch on your lower legs, especially around your shins and calves, the one that seems to have no cause and no cure, could be one of the earliest signs of lymphoma. I know that sounds alarming, but stay with me because understanding this connection could be crucial for you or someone you care about. Your lymphatic system is like your body's drainage network, and when certain cancers like Hodgkin's lymphoma begin to develop, they release inflammatory chemicals into your bloodstream. These chemicals have a particular way of settling into the lower extremities, creating a deep, almost burning sensation that feels like it's coming from underneath your skin rather than on the surface. What makes this so tricky is that your legs might look perfectly normal. There's no rash, no redness, no obvious sign of irritation, yet you find yourself scratching the same spots every single day. I remember speaking with Margaret, an 82-year-old grandmother, who told me she'd been using every lotion and cream she could find for nearly 8 months. She'd changed her laundry detergent, switched to hypoallergenic soaps, even bought new pants thinking maybe the fabric was a problem. But nothing helped. The itch was always there, always in the same spots on both legs, always worse at night when she was trying to sleep. It wasn't until her daughter convinced her to see a doctor about fatigue and some unexplained weight loss that blood tests revealed abnormal lymphocyte levels. Further testing confirmed what that persistent itch had been trying to tell her all along. The key thing to understand is that this isn't your typical dry skin itch. Dry skin responds to moisturizers, changes with humidity, and usually affects larger areas. This lymphoma-related itch is localized, persistent, and has an almost electric quality to it. If you've been dealing with this kind of sensation for more than a few weeks, especially if you're also noticing night sweats, unusual fatigue, or unexplained weight changes, it's time to have a conversation with your doctor about blood work. Now, let me tell you about an itch that shows up in one of the most unexpected places and often gets blamed on everything except what it might actually be. That deep, nagging itch right between your shoulder blades, the one that feels like it's coming from inside your body rather than your skin, could be your pancreas trying to get your attention. This might sound strange because we don't typically think of our pancreas as something that could cause itching on our back, but there's a very real medical reason this happens. When tumors begin to grow in the pancreas, they can press against or block the bile ducts. These are the tiny tubes that carry bile from your liver to your intestines to help with digestion. When these ducts get blocked, bile salts start to accumulate in your bloodstream, and one of the first places you feel this is in the dense network of nerve endings in your upper back. I spoke with Thomas, a 74-year-old retired mechanic who described this exact sensation. He said it felt like having a mosquito bite that he couldn't quite reach, except it never went away. He tried back scratchers, asked his wife to help, even went to a chiropractor thinking it might be related to his posture. But the itch persisted for months. It was only when he started having some digestive issues and went for routine blood work that his liver enzymes came back elevated. The imaging that followed revealed a small tumor in his pancreas that was indeed pressing on his bile duct. What makes this particularly important is that Thomas caught this early, before he had any pain, before his skin turned yellow, before he had obvious digestive symptoms. That itch between his shoulder blades was the very first sign his body gave him that something was wrong. And because he paid attention to it and mentioned it to his doctor along with his other symptoms, they were able to catch it at a stage where treatment options were much better. If you have this kind of deep, persistent itch in your upper back, especially if you're also noticing darker urine, lighter colored stools, or unexplained fatigue. Don't ignore it. Your back might be trying to tell you something about what's happening much deeper inside your body. Let's talk about your scalp for a moment. You might think an itchy scalp is just part of getting older. Maybe your shampoo isn't working as well, or perhaps the dry winter air is affecting your skin. But when your scalp itches persistently without any visible flakes, dandruff, or obvious irritation, and when that itch feels more like a tingling or crawling sensation that moves around from spot to spot, it could be a sign that something has happened with your blood cells. This type of scalp irritation has been connected to blood cancers like leukemia, particularly chronic lymphocytic leukemia, which is more common in older adults. What happens is that as abnormal white blood cells multiply, they can cause inflammation throughout your body, and your scalp, with its rich network of nerve endings and blood vessels, often becomes one of the first places to react. I want to tell you about Dorothy, a 79-year-old woman who noticed that her scalp started itching every afternoon like clockwork. She changed shampoos, tried different hair products, even stopped wearing her favorite hat thinking that might be the cause. But the itching continued, and it had this strange quality to it, almost like something was crawling under her skin. When she went to her doctor for a routine checkup and mentioned this persistent scalp irritation, along with some increased bruising she'd noticed, her doctor decided to run a complete blood count. The results showed elevated white blood cell levels, and further testing confirmed early-stage chronic lymphocytic leukemia. The important thing Dorothy learned is that her scalp had been trying to tell her something for months before any other symptoms appeared. That persistent, unusual itching was her body's first attempt to signal that her immune system was being affected by these abnormal blood cells. What makes scalp itching particularly tricky is that many of us do experience some dryness or sensitivity as we age, so it's easy to dismiss. But cancer-related scalp itching has some distinctive qualities. It doesn't respond to dandruff shampoos or moisturizing treatments. It often feels deeper than surface irritation, more like a tingling or burning sensation. And it tends to be persistent rather than coming and going with whether changes or different products. If your scalp has been bothering you for weeks or months, if nothing you try seems to help, and especially if you're also noticing increased fatigue, more bruising than usual, or frequent minor infections, it's worth having a conversation with your doctor about blood work. Now I need to talk to you about an area that's particularly important but often overlooked, especially for women. Persistent itching in the chest or breast area, particularly around the nipple or just beneath the breast, is something that gets attributed to everything from ill-fitting bras to laundry detergent to hormonal changes. But this specific type of itching can sometimes be the very first sign of inflammatory breast cancer or other tumors developing near the chest wall. What makes this so dangerous is that inflammatory breast cancer doesn't always present the way we expect cancer to present. There might not be a lump you can feel. There might not be obvious changes you can see in the mirror. Instead, there's this persistent irritation, sometimes accompanied by skin that feels slightly thicker or warmer than usual, or maybe just a general sense that something isn't quite right. I spoke with Eleanor, a 71-year-old retired teacher, who noticed an itching sensation around her left breast that just wouldn't go away. She tried different bras, changed her laundry soap, even went without a bra for several days, thinking it might be friction. But the itching persisted in the same spot, day after day. When she finally mentioned it to her doctor during a routine visit, her physician noticed some very subtle skin changes and ordered additional imaging. What they found was a small but aggressive tumor growing close to the skin surface, exactly where Eleanor had been experiencing that persistent itch. For men, this is something that's even easier to overlook because breast cancer in men is less common, but it does happen, especially as we age. That itchy patch near the nipple, that small area of skin that feels different or irritated, might not seem like something to worry about, but for someone in their 70s or 80s, it deserves attention. The key thing to understand is that this type of itching doesn't move around your body. It stays in the same place. It doesn't get better with creams or different clothing. And often, it's accompanied by very subtle changes in skin that might be hard to notice unless you're really looking for them. If you have persistent itching in your chest or breast area that's been going on for weeks, especially if the skin feels different in any way, don't wait to have it checked. Finally, I need to address the most uncomfortable topic of all, but it's also one of the most important. Persistent itching in the anal or genital area is something most people are embarrassed to talk about, even with their doctors. We assume it's hygiene or hemorrhoids or just part of aging. But when this type of itching becomes chronic and doesn't respond to usual treatments, it can sometimes be an early warning sign of cancers in these areas. For women, persistent vulvar itching that doesn't improve with typical treatments can sometimes be an early sign of vulvar cancer, which becomes more common after age 60. For men, persistent anal itching that seems to have no clear cause can sometimes indicate anal cancer or other issues in that area. And for both men and women, chronic itching in the genital region can sometimes be related to lymph node changes or other internal issues. I want to share the story of Robert, an 80-year-old man who dealt with what he thought was hemorrhoid irritation for over a year. He used every over-the-counter treatment available, changed his diet, tried different toilet papers, but the itching and irritation never fully went away. He was embarrassed to bring it up with his doctor, but when he finally did during a routine physical, his physician recommended a colonoscopy. What they found was a small lesion that had been the source of his persistent symptoms. The point of Robert's story isn't to frighten you, but to remind you that your body doesn't send you persistent signals without reason. When itching in any area becomes chronic, when it doesn't respond to reasonable treatments, when it keeps you awake at night or bothers you throughout the day, it's your body asking for help. I know these conversations can feel overwhelming, and I want to remind you that not every itch means cancer. Most itching is exactly what it seems to be: dry skin, irritation, or minor skin conditions that respond well to treatment. But what I want you to take from this is the importance of paying attention to patterns, especially persistent patterns that don't make sense or don't respond to logical solutions. Your body is constantly communicating with you, and as we age, those communications can become more subtle. Pain might not be the first sign. Obvious lumps might not appear right away, but irritation, persistent sensations, and changes in how things feel, these are often your body's first attempts to get your attention. If any of what I described sounds familiar, if you've been dealing with persistent itching in any of these areas, please don't ignore it. Make an appointment with your doctor. Be specific about what you're experiencing, how long it's been going on, and what you've tried to address it. Ask questions. Request tests if necessary. Remember that early detection often starts with paying attention to the small things and advocating for yourself when something doesn't feel right. Your health is worth paying attention to. Your concerns are valid, and your instincts about your own body matter more than you might think. Thank you for taking the time to learn about these important warning signs. And remember, knowledge is the first step toward taking control of your health.